Welcome to our video on the top 9 nutrients to reduce knee pain and osteoarthritis. If you're struggling with knee discomfort, you're not alone. Nutrition plays a crucial role in managing inflammation and supporting joint health, making it essential for anyone dealing with these issues. In this video, we'll explore specific nutrients that can help alleviate knee pain and improve your overall joint function. You can expect to learn about vitamins, minerals, and other dietary components that are scientifically proven to make a difference. Knee health is vital for maintaining an active lifestyle. So whether you're an athlete or just looking to enjoy daily activities without pain, this information is relevant for you. Let's dive in and discover how to nourish your knees. Before we dive in, please make sure to subscribe to our channel and click the notification bell to stay updated on our latest videos. Omega-3 fatty acids are renowned for their powerful anti-inflammatory properties, making them a key player in alleviating joint pain, particularly in conditions like knee osteoarthritis. These essential fats help reduce inflammation in the joints, which can lead to decreased pain and improved mobility. You can find omega-3s in various food sources, with fatty fish like salmon, mackerel, and sardines being top contenders. Plant-based options include walnuts, flax seeds, and chia seeds. Numerous studies have shown that incorporating omega-3s into your diet can significantly improve symptoms of knee osteoarthritis, enhancing overall joint function. By adding these nutrient-rich foods to your meals, you can take a proactive step toward managing knee pain and supporting your joint health. Vitamin D plays a crucial role in maintaining bone health and can significantly impact knee pain. A deficiency in this vital nutrient can lead to weakened bones and increased joint discomfort, exacerbating conditions like osteoarthritis. Ensuring you have adequate vitamin D levels is essential for overall joint function and pain reduction. You can obtain vitamin D through sunlight exposure, which triggers its production in the skin, as well as from fortified foods like milk, orange juice, and cereals. Fatty fish such as salmon and mackerel are also excellent sources. Maintaining sufficient vitamin D levels not only supports bone health, but also helps reduce inflammation, making it a key nutrient for anyone looking to manage knee pain effectively. Glucosamine is a natural compound that plays a vital role in supporting joint health and reducing pain, particularly for those suffering from osteoarthritis. It works by aiding in the repair and maintenance of cartilage, the protective tissue that cushions joints. As we age, our bodies may produce less glucosamine, leading to increased joint discomfort. Common glucosamine supplements include glucosamine sulfate and glucosamine hydrochloride, often combined with chondroitin for enhanced benefits. Research has shown that glucosamine can help alleviate symptoms of osteoarthritis, with some studies indicating it may slow the progression of cartilage degeneration. By incorporating glucosamine into your routine, you may experience improved joint function and reduced pain, making it a valuable addition to your knee health strategy. Turmeric, particularly its active compound curcumin, is celebrated for its powerful anti-inflammatory properties, making it an excellent ally in reducing joint inflammation and pain. Curcumin works by inhibiting inflammatory pathways in the body, which can help alleviate discomfort associated with conditions like osteoarthritis. To incorporate turmeric into your meals, consider adding it to soups, stews, or smoothies, or using it as a spice in curries and rice dishes. You can also enjoy turmeric tea for a soothing beverage. Numerous studies have highlighted turmeric's benefits for knee pain, with some research indicating significant reductions in pain and improved joint function among participants. By including turmeric in your diet, you can harness its natural healing properties to support your knee health. Antioxidants, particularly vitamin C and E, play a crucial role in reducing oxidative stress in joints, which can lead to inflammation and pain. These powerful nutrients help protect joint tissues from damage caused by free radicals, promoting overall joint health. Vitamin C is essential for collagen production, which is vital for maintaining cartilage integrity, while vitamin E helps reduce inflammation. Foods rich in vitamin C include oranges, strawberries, and bell peppers, while almonds, sunflower seeds, and spinach are excellent sources of vitamin E. By incorporating these antioxidant-rich foods into your diet, you can support your joints and potentially alleviate discomfort associated with conditions like osteoarthritis. Prioritizing antioxidants is a proactive step toward maintaining healthy, pain-free joints. Collagen is a vital protein that supports joint structure and can significantly reduce pain, especially for those suffering from knee issues. It provides the necessary framework for cartilage, helping to maintain its integrity and elasticity. Collagen supplementation has been shown to improve joint health by reducing inflammation and promoting cartilage repair. Food sources rich in collagen include bone broth, chicken skin, and fish, which can be easily incorporated into your diet. Research has demonstrated that collagen supplementation can effectively manage osteoarthritis symptoms, with studies indicating reduced pain and improved joint function among participants. By adding collagen to your nutrition plan, you can take an important step toward enhancing your knee health and overall joint comfort. Magnesium plays a crucial role in muscle and joint function, helping to reduce muscle tension around the joints, which can alleviate pain and discomfort. This essential mineral is involved in muscle contraction and relaxation, ensuring that your muscles function optimally and do not contribute to joint strain. Foods rich in magnesium include spinach, pumpkin seeds, almonds, and black beans, making it easy to incorporate into your diet. Additionally, research has shown a connection between magnesium levels and pain perception. Low magnesium levels may increase sensitivity to pain, while adequate intake can help manage discomfort. By ensuring you have enough magnesium in your diet, you can support both muscle health and joint function, leading to improved overall comfort and mobility. Zinc is an essential mineral that plays a vital role in tissue repair and immune function, making it particularly important for joint health. It aids in healing by promoting the regeneration of damaged tissues and reducing inflammation, which can help alleviate joint pain. Foods rich in zinc include oysters, beef, pumpkin seeds, and beans, providing a variety of options to enhance your diet. Adequate zinc levels are crucial for maintaining a healthy immune system, which can further support joint health by preventing infections and inflammation that may exacerbate pain. By incorporating zinc-rich foods into your meals, you can support your body's natural healing processes and contribute to overall joint comfort and function, making it a key nutrient for those dealing with knee issues. Fiber is an essential component of a healthy diet that offers numerous benefits, particularly in reducing inflammation and promoting weight management, which can significantly impact knee pain. A high-fiber diet helps regulate digestion and can lower levels of inflammatory markers in the body, contributing to reduced joint discomfort. Fiber-rich foods include fruits, vegetables, whole grains, legumes, and nuts, making it easy to incorporate into your meals. Maintaining a healthy weight is crucial for joint health, as excess weight places additional stress on the knees, leading to increased pain and discomfort. By focusing on a fiber-rich diet, you can support weight management efforts while also reducing inflammation, ultimately promoting better joint health and enhancing your overall quality of life. In this video, we explored 9 key nutrients that can help reduce knee pain and support joint health. Omega-3 fatty acids combat inflammation, while vitamin D strengthens bones. Glucosamine aids in cartilage repair, and turmeric, with its active compound curcumin, offers powerful anti-inflammatory benefits. Antioxidants like vitamin C and E protect joint tissues, and collagen supports overall joint structure. Magnesium reduces muscle tension, zinc promotes tissue repair, and fiber helps manage weight and inflammation. By considering dietary changes to include these nutrients, you can take proactive steps toward better joint health. If you found this information helpful, please subscribe, like, and share this video for more health tips. Together, we can work towards a pain-free and active lifestyle.